Our next guest is Dr. Joseph Kibler, a local podiatrist. Welcome back to the show today, Dr. Kibler. It's a pleasure to have you here.
Thank you for having me again.
Yeah, it's been a long time.
It's been several years.
Yeah, yes. Yeah. Well, how long have you been in Brunswick County, though?
It's
Several
growing,
years?
yes, by years. Last count, 13 years.
So you're almost a native, but not quite.
Almost a native.
Just
yes.
not quite.
No, not quite yet.
Well, I want to talk about your practice today. Tell us where your practice is located.
We are next to the old Brunswick Hospital on 17 in Supply, and we've been there for the full 13 years, and we serve all of Brunswick County.
Great. Well, let's talk about the various services that you offer there at your practice.
Sure. As a podiatrist, I certainly offer all basic podiatry services such as things like ingrown toenails, diabetic foot treatments, diabetic foot infections. We also start specializing in things like heel pain, plantar fasciitis, tendinitis. And we also treat broken bones, foot and ankle fractures. We do a lot of foot and ankle surgery as well. Bunions, hammer toes, Achilles tendon problems, ankle arthritis. So we really run the full gamut of anything you can think of the foot and ankle being a problem, we can take care of.
And the surgeries that you spoke of, where do you perform your surgeries?
Primarily at Brunswick Novant Medical Center. We also are staff at Dozier Memorial Hospital.
Good to know. Well, I hear that you have a new nail spa, and I want to concentrate on that today. I'm really excited about that, and I think that's a great topic for our viewers. So tell me about I believe it's a medical nail spa. Is that correct?
Correct, yeah. It came about, it's sort of organically developed over time. I've been thinking about it for quite a while because I would see people coming into the office, and they were coming in with ingrown toenails, infections of fungus, and some of them were getting quite severe. And there was always like, well, how long has this been going on? Well, a few months since I went to get a pedicure. And after a while, I said, enough is enough. Not that all pedicures are a problem, but there are some that can become an issue. And I wanted to be able to provide the people in this area a place where they can safely, cleanly get a pedicure done. And so I created the O Medi Nails and Spa, and we expanded that to not only include pedicures, but manicures and spa treatments such as aesthetics that include facials and waxings as well. So we've kind of taken the basic, we need to provide some safe, clean pedicures, and have expanded it.
Well, and that's really important for folks with diabetes. Is that correct?
Absolutely correct. Some people come in to see me because they are diabetic, and some people with diabetes have poor circulation, and it can be very dangerous for them to take care of their own toes or calluses and things that they may develop that need to be treated. But there's a lot of diabetics that don't have poor circulation, and they may not necessarily have to have the doctor be doing the care on a regular basis, but they need to go to a place that's safe and clean. And that's why we sterilize all of our equipment in autoclaves. We use all reusable, disposable equipment. All of the foot spas are thrown out at the end of the treatments.
And there are no drains or anything like that?
No drains or anything that could be recirculating, harboring fungus or harboring bacteria.
Now, I know it's next door to your practice.
Correct.
So I believe, or I would imagine that you have a relationship with the spa itself, and so probably you would get involved if
so occasionally my nail technician will call me, and I'll be seeing patients in my office and say, can you come over and take a look at this client? I've noticed that she may be getting an ingrown toenail. What do you think? Or I'm noticing that she might have a fungus infection. Should she be treated first, so then we can treat it and then allow her to go back to the spa on a long-term basis. Even just yesterday, she saw a patient that was wondering if the patient may have had a skin cancer. And I was able to go over and take a look and reassure the patient it was probably not a skin cancer, but be able to jump back and forth if needed, is very nice.
Right, yeah. So when Do you recommend for folks with diabetes that they have a professional cut their toenails rather than doing it themselves?
I do, especially for patients, again, who maybe have poor circulation, and a lot of diabetics have numb feet, or we call peripheral neuropathy. So if they can't feel their toes or can't feel their skin, it is particularly dangerous for them to be trimming their own nails. But even for people without those problems, it's always a good idea, because when you're diabetic, sometimes the immune system doesn't work so well because of the diabetes. And so people with diabetes are much more prone to develop fungal infections of the skin and of the toenails. And because of that, we really want to be very careful and make sure that it's exceptionally clean whenever it's done. So even if it doesn't have to be done by the doctor because of, let's say, poor circulation or nerve damage, then it can still be done by the nail technician, but again, in a clean, safe environment.
So if folks already have a toenail fungus, can they be treated at the Medi-Spa?
The Medi-Spa does not treat the fungus.
Right.
They would refer them to my office, and we would discuss different options. The first thing we would do is we actually test the toenail, because approximately 30% of all the nails that people think they have fungus in do not have fungus. And they'll argue with me, and sometimes, I definitely have fungus. Well, let's let the test determine it.
Yeah.
And the tests come back from the lab and there's no fungus found. So it's very important to get the test done, and we have many different treatments for that.
Well, if folks want to make an appointment, how might they do that?
Okay, to make an appointment for my medical office, they would go to InStride Brunswick Foot and Ankle Surgery, or call us at 910-755-6512. And for the nail spa, omedinailspa.com, or 910-754-9596.
Wonderful. Well, thank you so much for being here today. I hope to have you back real soon, and we'll talk about it some more.
Thanks for inviting me, Jean.
Thank you.